This last module of the male reproductive system will be looking at the cancers of the male reproductive organs. Although male breast cancer is rare, it is the one with the highest mortality and one that is more deadly than it is in women. And the reason why is because women often check for this in here, whereas men don't as much. The risk factors, of course, have to do with heredity. So if there's a history, family history of breast cancer, there is a presence of BRCA genes, which have been the ones that are identified with breast cancer. Obesity, hormonal issues, physical inactivity, these things in here basically contribute to breast cancer. And so it's recommended that men on a regular basis also check and screen for any changes in the nipple, to any puckering, to any discharge, to any lumps, and recommended this be done on a regular basis. Penile cancer is basically there's a variety of cancers that involve the skin and the soft tissues that can occur. So cancer can occur in different parts of this in here. Despite the daily observation of men's own penis by peen and just regular activities, the recognition of a lesion may be delayed, especially if there's no pain that is experienced. Now, the lesions of the penis often are benign, but they can also be malignant, that is to say, cancerous. If caught early, then this is usually treatable. And also, please note that this may be a sexually transmitted infection. Penile cancer is among the least common of the cancers. Testicular cancer is the most common cancer in men ages 25 to 34 years of age. There are a few symptoms that are occurring in early stages of cancer, and so the early detection is important. Testicular self-exam is recommended in the shower when individuals maybe when the water is warm and the testicles are hanging lower because the cremaster muscle is relaxed. This is when you may be able to detect any type of lumps in there. So symptoms are painless mass or hardness in the testes, pain or increase in size of the testes, lower back pain, gynecomastia, shortness of breath, urethral obstruction. Now, if caught early, this is one of the most curable forms of cancer. There's a high cure rate for it, and there are various forms of this in here: radiation, chemotherapy, or in the unfortunate event, but yet a better option is to remove the testicle. Please note that if an individual loses a testicle, he can still have children because the other testicle would be intact. However, radiation and chemotherapy can affect future fertility. The risk factors for testicular cancer include family history, cryptorchidism, which we looked at in the previous module, increased height, body size, age at puberty, and how it occurred, and also dairy consumption. Now, these are all correlational findings, not necessarily cause and effect relationships. Those are just risk factors. Additionally, new research has found that frequent marijuana use, daily or greater, increases a man's risk for testicular cancer. This is as of 2011, and so there's more research that should be done with this particular consumption of a substance. Prostate cancer is also another one that is a fear and a common one. The prostate glands will enlarge with age, even without cancer. This is not the issue. In fact, the BPH, benign prostatic hypertrophy, is a common enlargement of the prostate in most men after about the age of 50. So whenever you go to the doctor, they will detect that the prostate has become larger if you are older, but they don't necessarily use that as the ultimate way to detect cancer. Prostate cancer, as we said earlier, is one of the most common in American men, typically affecting men over the age of 50. But we also find that having a high-fat diet, race, we find it's more common among blacks than it is among white, and heredity. There's a family history that increases the chances. Now, the symptoms that we see in here, pain in the lower back, pelvis and upper thigh, urinary abnormalities, sometimes discomfort, and then urinating more frequently than before, And one of the ways that this is detected is through a rectal exam and blood test. Now, this is recommended yearly, beginning at the age of 45 or 50 years of age. But again, if there's a family history, then they recommend that you start it earlier. This particular rectal exam is one of the common ways to assess for growth of the prostate. However, keep in mind that the size does not necessarily coincide with cancer alone, as it will get bigger as we get older. In 1986, the USDA Drug Administration approved the PSA, prostate specimen antigen, which is a blood test that measures the levels of molecules that are overproduced by prostate cancer cells. This does not detect all tumors, but high readings indicate something such as a tumor is releasing prostatic material into the blood, and so it would then be correlated with the size or the growth of the prostate to determine if there may be cancer there. This is an issue psychologically for a lot of men, as many that may not be so sure or feel threatened by the discomfort that would be experienced in here often delay this particular test. It is important to note that you can communicate with your doctor, and that for the most part the argument is that this is done in a not so invasive way, and it doesn't generate a lot of discomfort for the individual. And so what a lot of medical practitioners often say is that it really comes down to the taboo that may be associated with having something inserted up the rectum. The treatments that exist for prostate cancer are radical prostatectomy, which is basically a surgical prostate removal, radiation treatment, cryosurgery, which is basically freezing techniques to destroy part of an organ, Provenge, which is USDA approved in 2010, and basically is a vaccine that uses the patient's white blood cells to attack cancer cells. This is very, very interesting because, as you may already know, white blood cells are there when there's something, some type of infection, something that occurs, and so the increase of those would, rather than just alert, they would actually start attacking the cancer cells. And so this is something that is now being used to help individuals who may have also a history of prostate cancer. However, it's important for you to note that sometimes in older men who may have a not so good health, rather than treating this in here, they may simply wait, and that's what they call watchful waiting. If they know that the health of the individual is not the greatest, and chances of them dying for other reasons are there, then they simply just wait to see how this progresses, because prostate cancer is considered to be one of the slowest in growth. So there are other like breast cancer, that is very aggressive and it expands quickly. Prostate cancer is not. It's a form of cancer it's known for its slow growth, and so because of that, and because taking into account the individual's health, they may just choose to wait and watch how the prostate progresses, like how the cancer progresses.